So in this scenario, the action I would take would be to notify my CI and a supervisor at this clinic that a patient approached me and said that they observed this other student taking money from a staff member's desk. Um, the way I kind of thought about this, initially my mind went to handling it at the lowest level. That's kind of what I was taught in the military from a leadership perspective. However, when considering that, on one hand, if the patient or excuse me, if the classmate did indeed do this, um, it might be easier for them to just dismiss me if I approached them and asked whether they did this or not. And then at that point, the crime would go unsolved. On the other hand, if they did not actually steal the money, um, I wouldn't want that to negatively impact kind of their experience at the clinical rotation or maybe their experience treating patients if they feel like they are being accused of something at the clinic. But given the history of thefts, it still needs to be addressed. So I definitely would not just do nothing. I would want to address it. So I would go to my CI, go to my supervisor or the supervisor at the clinic and just say, this patient approached me. You know, this student is well respected and they're a leader in our class, so they don't seem like somebody that would do this. However, given the history of thefts, I just wanted to bring it to your attention in case you wanted to investigate. And then from there, I would let them kind of handle it. Maybe talk to the student and kind of go from there. I think that's also more respectful of their leadership, of their experience, and more respectful of the clinic to kind of help them address the problem at hand. So that's how I would approach this problem.